is the Commissioner, Stephanie Moore, and I am so happy to be your host here at Table Talk. And today I have a very, very special guest. She's an amazing woman from Kalamazoo, hailing from the east side of Kalamazoo, and just doing phenomenal work through her own personal efforts, but also her business venture through a nonprofit called Smile Savers. You guessed it. My guest is the one and only Tiffany Burns. I want to give her a chance to introduce herself to you, give you some little fun facts, and then we're going to talk a lot about Smile Savers and what you all can expect for her in the future. Tiffany.
Hello, everyone. Hope everyone is good in this pandemic that we're going through. As Stephanie said, I am Tiffany Burns. I'm sure all of you have seen me out there. I'm Smile Savers. I'm the face of Smile Savers. If you see me, I'm always asking you if you floss, so get it together. But I am a dental hygienist, and I have been a dental hygienist for 16 years. I've been in the dental field for over 30 years. So I worked in a private office and also worked in public. So as I was working in the public spectrum of dental, I found out that there was a need for dental for those who didn't have insurance or for those who couldn't get to the dental office. So as I proceeded in my career, my passion drove towards more of helping those people who could not get dental care. So that's how Smile Savers was constructed. It's a nonprofit. We've been in business 6 years. 6 years. And still trying to get the word out about the importance of dental health. It is so important to overall health. So that's what we're doing with Smile Savers, trying to get the word out about the dental care in the community.
Well, congratulations on 6 wonderful years of having impactful service here in Kalamazoo to children, to adults and families.
Yeah.
Tiffany, let's talk for a minute about how important dental hygiene and dental care is.
You're going to get me started. Okay, here we go. Oral care is often neglected. I mean, you take care of everything else. The only time people really pay attention to oral care is when they have a toothache. And then they're running around trying to find a dentist that can provide them care, but they are not a patient of record. So it's harder for them to get care. So that's one of the main things I stress to people is to find a dental home. Just like you have a doctor's office, you can call if you're sick and you get into the doctor, same thing as the dentist.
So you should have a primary care physician as well as a primary dental?
Yes.
Okay.
Yes. For the same reason. So if you have a toothache, you can just call your dentist and they can get you in and help you. If you don't have a dentist, if you're not a patient of record at a dental office, then you're calling all around town and then it's harder for you to get in and get service. So I try to stress that to everybody. Make sure even if you go once a year, the recommended visits are twice a year for a cleaning. But if you have perio conditions or have to come in more frequently, it's 3 to 4 times a month. But still go in at least once a month to get a checkup so you can be an established patient. That is the key.
Wow. So don't wait until it hurts or something's wrong. Have consistent every month dental care. So talk to me about when with kids, what are some of the issues that you see in your younger patients?
Well, right now, especially too, that everybody's shut in, there's more frequent eating. So everybody's eating a lot more, drinking a lot more, probably not water, but juices and sodas. So that oral care factor is probably not even important right now. So I can see after this is done, there'll be a real surge in dental care for children because they might have a lot of cavities. Now with the dental care, I can go on and on about with kids. First of all, age 1 is the age that you get your children in for dental care. A lot of people say, why? That is because they have those 2 teeth down there. And that's all they have about time they want. But the important reason for them to bring them in is to educate the parent on foods, healthy things to do for the teeth, brushing, things the parents can do to incorporate good oral habits so this child can grow up to get, for good oral health.
Yeah, that makes sense.
Yeah, so that's the reason. So now if a lot of the moms are taking their children in for their well child visits, you might have the nurse put on fluoride of the children's teeth now. They've incorporated that now, dental care with well child visit, because by the time they saw all these infants and toddlers, they had rampant decay because they weren't going to the dentist. So they started to try to do the, the incorporation model of integrated model of medical to incorporate dental into, the well child visits to kind of help bring that down, which is helping. It definitely is helping. But
so
I think.
Let me ask you. So if I take my child and my toddler, for example, to the doctor, and we're dealing with also issues around dental and oral hygiene, and if a nurse asks me, do I want fluoride for my child? Should I say yes, or is that a good thing?
Yes, you should say yes. And let me address fluoride too, because I know there's a lot of controversy over fluoride saying it's poisonous. But the thing is, the fluoride that we use is topical. So we just paint it on the teeth. So it soaks directly into the teeth to help the enamel stay strong. So that's the main purpose of fluoride, to help the enamel stay strong and resistant to decay. So now we paint it on. We used to have the trays or people would rinse with it, but most kids ingested it and would give them an upset stomach. So the controversy is it poison, and causes cancer. But I always like to educate, because you literally have to be ingesting it every day at extreme amounts to get any effect. So I always say the benefits outweigh the risks. And if you're an excellent brusher and you floss and you have good nutrition, you might not have to worry about the fluoride. But fluoride is in your toothpaste too, and in the drinking water. So that's something to know too.
Oh, awesome. Awesome. Mm-hmm. So what about in patients, adults that are dealing with some dental issues or maybe some things that they need to know?
Oh, wow. Okay. First of all, I'd like to go back to the COVID. So a lot of people have underlying conditions, like we said before: diabetes, heart disease, cancer, Crohn's disease. I mean, almost all the diseases are systemic and deal with inflammation. Mm-hmm. Periodontal disease is the inflammation of the teeth and gums. So most people,
say that again. It's called the what?
Periodontal disease. Periodontal disease is a chronic inflammation of the teeth and gums. So think about it. You got this bacteria and these germs in your teeth. You have inflammation that you never address. But you have diabetes. You might have heart disease or something else. You have this disease and this inflammation in your body, which can travel to other parts and cause more problems. So oral care is often overlooked when looking for a solution, to help manage these systemic diseases. It's the last resort, but it should be the first resort, because that's probably one of the main things that is helping, not helping them control their disease, especially with diabetes. If you have perio disease, it's harder to control your A1C levels because of the inflammation. So I always tell diabetics, get your teeth clean, and you definitely have to go in every 3 or 4 months to get those clean. Let me touch on that too, because I want to explain something about cleanings. A regular cleaning is basically you're healthy. You come in, you got a little buildup on the bottom part, a little plaque. Probing. If you go in the dental office, they should use a little measuring tool that goes around your gums and measures your gums. Make sure you ask what the readings are. 0 through 4 is normal. So your gum tissue is normal. You really don't have any bone loss. You might have a little bone loss. Okay. So you're a normal cleaning. That means your insurance company will pay that 100%, no problem. Okay. Or you might have a deductible, but usually it's 100%. Now, if you're a periodontal cleaning, you might come in every 3 to 4 months. That is not a regular cleaning. Your insurance does not cover that at 100%, so you may be out of your pocket. How do you know if you have periodontal disease? When I'm measuring, if it's 5 and above, flat out, I know something's going on. Mm-hmm. You got bone loss. If it's bleeding, if it bleeds when I touch it, I definitely know something's going on. Bacteria is down there. So a lot of people get in these little frants about the dentist is charging me too much or they doing too much. And no, you have to understand what we're looking at to, evaluate the disease and how to approach the disease so we can heal you and make your mouth healthier. So I like people to understand that, because a lot of people get confused and wonder why they got this bill after this, or why they have to come in more frequently when their teeth look okay. But down below, once I get down there, they're not good. The base is not good.
So you're saying that they may not automatically just tell you what your readings are. You should just ask for them. And once you know, then you know where your standing is.
Yeah, and they should tell you. And pretty much if they're doing their job, they should be like, okay, I found, this reading up here in your upper left, And that's another thing I like to, say, be proactive about your health. Please be Don't let anybody tell you what's wrong with you, or just give you meds to medicate or Band-Aid over the disease. Get to the core, get to the source of what's going on, so you can cure that and move on. So, and periodontal disease it's not curable. Once you have it, but it is maintainable, and that's because you have suffered bone loss, which anchors your teeth in your mouth. So the main objective once you have periodontal disease is to maintain that bone so you keep your teeth in your mouth and you can chew.
Oh, awesome. So talk to us, Tiffany, about Smile Savers services. So if I come to you as a client, what can I expect? Or
Smile Savers is
would
mobile.
You be coming to me?
Yeah, there we go. That's the unique thing about Smile Savers. We're on site. So my passion is the children and the seniors. And I'm trying to reach more seniors this year because Medicare has expanded their coverage and added dental. So a lot of seniors have dental coverage now, and a lot of them are just now catching on that they have dental coverage, which is awesome. It covers cleanings, exams, and I think x-rays, which is fine because at least you can go in and get that checked up. So I can come to you. I've been getting a lot of homebound patients lately, which is awesome because they haven't had care in years. So just imagine your mouth is dirty and then you get somebody to come in and clean it for you. These people are so thankful for this. Yeah. So yeah. So on site, people who work a lot, that's a lot of things we're running into. People who can't get off work to go to the dentist. They have their insurance and they want to go, but they can't get off. So Smile Savers was created to address these barriers, to try to make sure that I can do to the best of my ability to get out and service people who need dental care, because that is important to overall health. And once people really realize that and experience what a real good cleaning is, that will change their behavior and make them be more proactive about their oral health.
Oh, awesome. So if I got some issues, or even if I don't have issues, I just need to get a cleaning or establish a relationship with a hygienist, I can call you, make an appointment, and you will come to me.
Yeah. And my thing, I'm a resource in the community, people. If you got a tooth issue, call me. I'm going to get you together. I'm going to tell you, point you in which way to go. And the main thing is educating about dental, because, if you don't understand, they'll tell you anything. And then most of us will be turned off by that and won't go through with what we need to do to keep our oral health, healthy. So it can help our overall body. So if any questions, anything, please feel free to contact Smile Savers.
Absolutely. So what about if I have insurance or I don't have insurance? Are you able to still treat people?
Yes, I am. I am able to accept state-funded insurance. And lately, I'm able to accept corporate insurance. So if you work at Bronson, I'm able to accept your insurance. If you don't have any dental insurance, I have a sliding fee scale. And that will depend on the condition of your mouth also. How long you haven't had a cleaning, how much work I have to do.
So what's the best way for people to contact you?
269-270-7060. Website, www.smilessaved.com. Email is smiles, SMILESRESCUED @gmail.com. One thing I wanted to touch on real quick, snoring. Lately, sleep apnea is a big thing. And everybody's kind of going through that right now, different sleep patterns. One thing we've been noticing in children, children are being misdiagnosed with ADHD. Mm-hmm. And it's really because they're tired. When children have lack of sleep, they're very hyper. So it's the opposite of us. We get irritable and, grouchy and mean. Children get hyperactive. So a lot of these children, also that pertains to dental care too, a lot of these children have rampant decay with holes in their teeth, which makes them hyperactive. So they get misdiagnosed as ADHD also when it's just a toothache. But the sleep apnea, children should not snore at all. If they're snoring, they're not getting enough oxygen. So they're mouth breathing. They should be nose breathing. So parents, watch your kids when they sleep. If they're restless, if they're snoring, get them tested. Don't go for what the doctor says. Go ask the pediatrician. Just be rampant about it, because this might be affecting their learning because they're not getting enough oxygen and not resting. Same thing with adults. You might be dozing off by 3 o'clock or sleepy. You might not be resting enough because you're not getting enough oxygen while you're sleeping and not reaching that deep level of restorative sleep that you need. So I just wanted to touch on that because we're seeing more and more of that. And just because we are in your mouth, we can see like tonsils, your tongue is different, your tissues are different. Yes, all that is different. Can I touch on COVID-19 with the dentistry, please, Rick?
Yes, please. Yes.
I don't know if everybody really knows, but even before this was going on, dental hygienists and the dental team, we need masks and gowns every single day and for every patient. So even before this started, we were getting low on masks because we couldn't get them because everybody else were using them. But when we come back from this, let me back up. We are the #1 high-risk profession due to we're in close contact with you. We are exposed to your droplets, your spit, all of that, and contact. We touch you. So yes, we're going to be the ones who are right up in that. So in the procedures that's going back, all dental offices are closed at this point. If you have an emergency, and an emergency means your cheek is out here. You wake up, you're throbbing. That's an emergency. That means you have an infection. Your dentist, if you have one, will get you in, probably give you some antibiotics. That's it. So no services are being done right now. But upon reopening the dental offices, we already do infection control to the utmost. But it's going to be a lot different when you go back to the dentist. It's probably going to be a lot slower because they have to schedule patients farther apart, do the social distancing. So people just be aware that, be patient with your dentist when we come back. Please make sure you're doing good oral care right now, flossing, rinsing, and all that, making sure you're brushing your kids' teeth while we're in this pandemic.
Let's talk about the issue of decalcification. Do you see that a lot? And is that something that parents and patients should be concerned about?
Oh, definitely, Stephanie. Good question. Decalcification. If you drink soda, that's the main thing. Soda, Red Bull, any energy drinks, Gatorade also. You have these white chalky spots. That's the best way I could say them. Chalky spots on your teeth, and that's decalcification, basically weakening enamel. So you can get a cavity in that area. So I see that a lot on young children, 3 and 4 years old. If I lift their lip up, they have that white chalkiness right up there. So I know parents aren't brushing their teeth because they're not lifting their lip and getting up there. Kids, teenagers, I see this a lot on teenagers because they're just drinking soda, drinking Gatorade, drinking the Red Bull. And then on top of that, eating the high processed foods, those Takis. Please don't eat Takis. Don't give your kid any of this hot stuff. The hot Cheetos and stuff, all that is not good. It's not good for the kids. But the decalcification, one thing about it, it never goes away. It never goes away. So I can look in your mouth, even if you drank soda 10 years ago, I can tell you did just by looking in your mouth from that decalcification. Wow. The one thing to help keep that from turning into cavities is fluoride. So a fluoride rinse like ACT, every night helps.
So, Tiffany, I get to spend some time with you periodically, sometimes a lot. And I hear you all the time and you'll say floss, make sure you floss. And sometimes we laugh and we're like, oh, that's just Tiffany. But talk to us about how serious flossing is, because many of us, we think, okay, if I brush my teeth every day, I'm good. But are we intentionally thinking about flossing, and does it really matter?
Flossing does matter. I always tell people you can brush 5,000 times a day. I don't care how good of a brusher you are. Those bristles cannot get in between your teeth. So flossing, you put it in there, bring it right on out, curve it towards your tooth like a C to go on each side of the tooth. But one of the best things to floss with is a water pick. If you can get a water pick, excellent, especially if you have periodontal disease. Excellent. It's like a power washer. That's what I call it for the teeth. You push the button, the water gets down there, and it just blasts everything out of those pockets and keeps your teeth clean. Flossing is very important. You get cavities. A lot of people get more cavities in between, and that's because of not flossing. That's why we take x-rays. I can see in between to see if you have cavities, and that lets me know you're not flossing.
Oh, wow.
Very
So,
important.
I also looked on your webpage not too long ago, and you were talking about brushing the tongue, and you just mentioned earlier bacteria. So is that something we have to pay attention to as well?
Definitely. A lot of people say they don't brush their tongue because they gag. I say, okay, that's God's natural reflex for nothing not going down there naturally. Good. A trick to brush your tongue, you lean over, tilt your head all the way over, and keep your tongue out. Let your tongue hang. And you stroke it. The more you do it, you will build up a resistance and you will not gag. You should brush your tongue every single day. You have to think where you swallow in the back of your tongue. You want to get back as far as you can, because where you swallow, that's where all the bacteria is. So if you're having bad breath or anything like that, brush your tongue. You don't necessarily need to get a tongue scraper either. You can use your toothbrush.
Mm-hmm. Okay.
Yeah.
So what about the issues with cavities? So many people have cavities and they like, well, I already know I got it. Maybe I don't need to get it filled. How important is it to address cavities?
I always tell people, once that dentist says you have a cavity, get it fixed. A lot of people don't, because they're like, oh, it doesn't hurt. But if you get it fixed when they tell you at the early stage, it saves you time, money, and pain. Because the more you let it go, the surfaces get bigger. That means the dentist has to restore more tooth. So that's more money that you have to come out your pocket, because fillings aren't covered at 100% by insurance.
Right.
So I always tell people, don't wait. And the most extreme of letting a cavity go is that abscess, where over years and years, you know you had that cavity. You just let it go because it didn't hurt. Then all of a sudden it blew up on you. Then you're at the emergency, which they can't do anything. Do not utilize the emergency room as a dental office. They can't do anything. They just give you some meds and send you on your way. You need to take care of the source and get to the dentist.
Well, I noticed you do a lot of things in the community. So you're connecting, engaging with children and families. Mm-hmm. Where can people expect you to see? In schools and churches? Smile Savers is on the go.
Yeah, I'm trying to get out there, Steph. You know what I'm saying? But, right now, I know, because school is closed down, because I had a couple of schools scheduled. I think after this is opening up, I'll be at a lot of community centers. Okay. So parents, if your kid needs a cleaning, just look out for Smile Savers, because I'll be definitely at Interfaith, New Village, and work. And I'm not sure about Fox Ridge. I still call it Alamo. But, just trying to get a central location to where people, if they have to travel, they don't have to go that far to set up a clinic. Now, sometimes if I try to set up community clinics, like at the Eastside Neighborhood Association, the Douglas, I'm going to work on that. But I'm going to try to do more clinics in the community, especially for seniors to come and get oral care, because it's very important. And then minding people, I tell people, don't be afraid of how your mouth is. I know a lot of people are very timid about when it gets to your mouth. It's okay. I always tell people, it's okay. We'll work from where we're at and we'll get you together.
Right.
And your smile.
You're not going to judge anybody. You just let me save your smile.
Yes. And to educate you on what to do to make your smile the best for you. The best for you. Because everything doesn't work for everybody. All these whitenings, all these toothpaste are a lot of gimmicks, and for marketing. So it's just doing the best to help you achieve good oral health. Well,
I want to tell you firsthand and hear publicly that you always will have space on 8th Street at Mother's.
Oh, yes.
You come whenever you want. You schedule. Our door is open. We will
awesome.
We will give you whatever you need.
Awesome. We're going to make it happen, Steph. We're going to make it happen.
Absolutely. Yeah. So someone who not only supports you because you're just a phenomenal woman anyways, I truly support the work that you're doing with Smile Savers. It's more important for somebody like me who loves that everybody else feels the same way about theirs. And if you have to do some things to repair you, to get you on a journey to better oral health, I strongly suggest that they reach out and contact you, Tiffany, at Smile Savers. So I want you to, one more time, let people know how they can contact you.
You can contact Smile Savers, 269 270-7060. Email smilesrescued, all one word, SMILESRESCUED @gmail.com. Website, www.smilessaved, all one word, SMILESSAVED.com.
Awesome. So, Tiffany, we never leave this table without encouraging folks, giving them some enlightening information. So I want to give you a chance to talk to your community, even during this time of pandemic and all that we know is going on. There's some good in all of this.
Oh, definitely. I'm a woman of faith. Y'all better get some Jesus, first of all, because he gonna help you. Really, he is. And Ecclesiastics, I think it's 3:1-8. We're doing at Mount Zion right now. A season. There's a season for everything, people. So this too shall pass. But while you're in this, stay positive. You know, improve yourself, improve your family, improve your house. Do what you need to do to improve yourself, to make yourself and the community better. And we'll all be better together. Just work on you and don't be judgmental. Everybody needs help. We're all out here to help each other. Okay, so let's do this, and let's get Steph in office too.
Now that's keeping it real at the table. Get it, girl. So, Tiffany, it's been more than a pleasure to have you on, and I hope that you would come back to Table Talk again. I tell people all the time, I came up with this thought of Table Talk because one of my sheroes is Shirley Chisholm. And he said that if they don't create a seat for you at the table, then bring your own folding chair.
All right.
For years, being in public service and being an activist in the community, I was always bringing my own folding chair. And then I got tired of carrying it. And I said, you know what? I'm going to create my own table.
Right.
So here we are with a platform to really highlight and elevate people like you who are doing extraordinary work in the community, and making sure we're making that connection from the service you have to offer to the need that's already in the community. So again, I want to commend you and thank you and encourage you to keep on keeping on, walking boldly in your faith, in your purpose, and knowing that you are doing a phenomenal job. So I appreciate you being at the table. Give you a last chance to say goodbye to the folks.
Goodbye, everybody. I appreciate you, Steph. Keep doing what you're doing and for the community. And people, we need to lift her up and keep her encouraged, and us all do the same too. Everybody stay safe. I wasn't done. That's my ending line. Y'all stay encouraged and be blessed, and make sure you floss. There's nothing like that feeling of clean teeth. I'm just telling you.
All right. Thank you, Tiffany, for being here. That's us keeping it real at the table. We'll see you again live on MOOReTv. We'll have other guests that are coming forward soon. And again, go to smilesavers.com, call Tiffany and schedule your appointment. Make sure that you are ready and available. She will come to you, and do not forget to floss. Thank you.
Thank you.